Welcome and hello again from St. Mary's Hospital. Welcome to our Focus on Facebook Live. My name is Hasnain Kermali and the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to highlight some of the new and upcoming opportunities and sectors we have here at the hospital and what we're able to provide to the Waterbury market, insight into the services and the expert providers that we have available within our hospital system. Today, I'm glad and welcome to Dr. Wess Cohen, who's here in our plastic surgery department. Welcome, Wess.
Thank you so much.
In the short time you're with us, I'd like to get a little bit of information about personal history, personal story about what brought you into the field. And then let's talk about plastic surgery and the world of plastics. And what it means to the patients in the greater Waterbury area. Welcome again. So, you were trained in some of the top plastic surgery programs in the nation, Memorial Sloan Kettering and Lenox Hill. What drew you, even before that, into the field of plastic surgery?
Yeah. So I actually started my kind of surgical career as a general surgeon. So I started my residency in that, and while taking care of the kind of classic general surgery patients, I was always drawn to the plastic surgery procedures, and the most significant was the breast reconstruction patients. So we would do a lot of mastectomies and treatment for the cancer aspect of this patient's care, and then I would always stay in to help out with the plastic surgery part. And I found the rewarding aspect of being able to recreate a defect, recreate a sense of normalcy for the patient, after having undergone such a traumatic experience, really drew me to love the field and to love the patients that I get to interact with.
That's great, particularly when it comes to, again, helping them get through the trauma of not only such a devastating diagnosis of cancer in and of itself, but how it's going to personally affect them with the breast health and sort of where that goes going forward.
Yeah, absolutely. So, specifically for breast reconstruction, it really is kind of a shining light to an otherwise kind of long and arduous treatment course. And, my goal is to really bring back, quality of life, confidence, and just general well-being for these patients.
Yeah, and the you've trained at a very large cancer institution, so your breadth of evaluation must have been pretty extensive.
Yeah, and so my time at Memorial Sloan Kettering was primarily focusing on kind of patient-reported outcomes specific to breast reconstruction. So what that was how can we kind of interact with the patient at every level, whether it's from an office staff standpoint, from a surgeon standpoint, from a preoperative standpoint to a postoperative standpoint, to really focus on patient care and patient excellence to give the patient, not only the best surgical outcome, but the best environment to have that surgical outcome in.
And so it's not just about the outcome, but when you talk about environment, it's the whole person, not simply what happens in one spot.
Exactly. So, the operating room is a moment in time, but the doctor-patient relationship, the doctor kind of hospital and staff relationship goes on, and there's different things we can do along the way to get the patient to what her goal is for breast reconstruction, or his or her goal for any other type of plastic surgery. And that's a constant communication between myself, the patient, and my staff, because the end point is patient satisfaction, and that's in addition to a great outcome.
And so it's wonderful to see, again, one of our philosophies that we like to push here at St. Mary's is patients are going to come first and be in the center of that entire model that's circling around them. So it's great to hear that that's the exact philosophy that you're bringing into the plastic surgery world as well.
Absolutely.
So let's talk about the services that you are able to provide. You mentioned breast reconstruction, so we can start there. And then what other services can you bring into plastic surgery here in Waterbury?
Yeah. So, I took an additional year of training after, long residency training, specifically focusing on aesthetic and reconstructive breast surgery. So what that is a pretty unique fellowship, which I did in Manhattan. And kind of half of my training was doing breast reconstruction after cancer, and then the other half was doing aesthetic surgery. So those are two of my passions within plastic surgery, and what I am excited about being able to offer in this community.
And that really goes hand in hand with our strong breast surgery program that we have here, and the connection you have with our surgeons and now also new surgeons that we're bringing on board.
Yeah, absolutely. So, the breast surgeons here and the, kind of whole cancer institute, offers great care, and they're extremely busy. So to be able to kind of join the team and bring, the reconstructive aspect to that is something that I'm really excited about moving forward with.
So when do you see the patient? I mean, if somebody gets diagnosed, they go in, and we just finished, of course, Breast Cancer Awareness Month. So, and our Pink Out campaign as well. But when does a patient see you in the course of their treatment? Is it early on? I mean, at the beginning, I imagine the last thing on their minds is figuring out plastics. But when do you see the patient?
Yeah, it's a great question. So, typically, and there's kind of different ways and different ways that patients come into the system. So typically, a little bit after the diagnosis, once kind of the treatment options are available to the patient in terms of how their cancer is going to be treated, and then are they going to be a surgical candidate? Are they going to be, a candidate for a lumpectomy, or are they choosing or do they have to have a mastectomy or a bilateral mastectomy afterwards? And kind of once those decisions are close to being made, maybe not set in stone, then that's when I typically get involved, because what I need to do is I need to recreate a sense of normalcy, but I need to know what is going to be abnormal first. And so that way the patient isn't inundated with kind of the history of breast reconstruction and every option that may be available. At least we can stay focused, because every patient that comes to me, they have multiple options available, and that's really what I pride myself in within plastic surgery and breast reconstruction specifically, is any kind of surgical option that is on the table when a patient comes and speaks to me, if they're a candidate for it.
So and let's talk briefly about those different options, because in my mind it used to be just one,
right?
And you're bringing to our area really a slightly different perspective on that.
Right. So traditionally we would speak about, breast implants, and there's a couple different kind of ways to do that. But at the end of the day, a patient would end up with either a silicone or saline breast implant in place of the breast that they had. So kind of when I think about breast reconstruction, how I talk to my patients about it is a breast is kind of like a pillow in a pillowcase. So the breast surgeon will remove the pillow, and I'm kind of left with the pillowcase, so we need to find something to fill that void. So my options are, and this is what I bring to the table, is we can do the implant route, which can be a great option for many patients, or the other option is to use a patient's own tissue. The most frequent of that being tissue from their abdomen, so it's called the DIEP flap, DIEP. It stands for the blood vessel where that is supplying the skin and the fat. And what that is I take the skin and the fat that would typically get thrown away after a tummy tuck, so below the belly button. I take its artery and vein, its blood supply, I take it off the body, and I reconnect it to the blood vessels in the chest with the assistance of a surgical microscope. So I sew those blood vessels together. They're, a couple millimeters in size typically. And then now that patient has their own tissue, natural feeling, natural looking, instead of an implant in place. And the great thing about this option is, forget about all the not having to worry about implants, but they also, that tissue will kind of grow or shrink as the patient's body habitus changes over time. So it is a long-standing, long-lasting result for the patient.
And that sounds remarkable for the patient. Is that longer surgery than just a simple implant?
Yeah, so
Sounds a bit more complex.
It is definitely, on the upper level of complexity. There's an additional year of training kind of to be able to offer that unique skill set. But the surgery itself is longer than an implant surgery. And it does require kind of 2 to 4 night stay in the hospital, and that's solely just to make sure that those blood vessels are staying open, and that the blood is flowing how it should flow during that time. The nice thing about this surgery versus implants is while it's a little bit more work up front, a little bit larger recovery because I'm operating on the abdomen and the chest, you don't need to have your implants revised or changed 10 or 20 years down the road.
Right.
So over the time of a life, that's actually less operations are involved for having kind of a deep flap or using your own tissue than implants, even though implants are quicker and easier to get back to work if, kind of depending on what the patient's goals are. And that's why it's so important to have a real honest discussion with the patients that come in and what they're looking for.
Yeah, and so, I mean, it just opens up a whole other field for them and different options that they have to then think about and consider. But it really brings back that natural aspect of aging for the patient themselves as they continue with their trajectory and their journey post therapy.
Absolutely. And we brought up this topic kind of when does the patient come to you? And I just need to be clear with everyone out there that just because you've had implants in the past or a deep flap in the past doesn't mean you're not a candidate for the other option afterwards.
Okay.
So if you're unhappy with your reconstruction, you don't like your implants for whatever reason, or you weren't offered breast reconstruction initially, there are still options available to kind of transition from one reconstruction to another or to start from scratch.
So, and you're able to do all of that.
Yes.
Here now again for our patients in the greater Waterbury area. So that's breast reconstruction. Thank you for bringing that on board here. What else are you able to offer here for our patients?
Yeah, so I offer the gamut of aesthetic surgery, and what that is are cosmetic surgery, and that's ranging from injectables, so for facial rejuvenation, which is Botox or filler, kind of for some preventative care, and that goes all the way to a facelift, a nose job, a breast augmentation, tummy tuck, those are kind of my bread and butter cosmetic cases that I will do, and obviously anything kind of breast surgery from a cosmetic standpoint as well.
Right, and then and I'm going to say this jokingly to some degree is don't be humble, because I've been seeing you also working with our trauma team on the inpatient side and some of our other complex neurosurgical cases as well, and helping with some of those other pieces.
Yeah, and the trauma aspect or the cancer, non-breast cancer patients, is also something that I'll be involved with, and have been involved with. So whether it's, lower extremity trauma that I've had to move some muscles around to kind of salvage a patient's leg to make sure that they don't lose their leg.
Yep.
And then also for, patients that have a neurosurgical issue and there's some question whether to the viability of kind of either their skull bone or the skin overlying their skull to make sure that they don't get an infection, deep within their brain. Those are things that I, assist with as well.
So it's remarkable just to think about, because sometimes the persona of plastics is just about cosmetics.
Right.
But that's really just if it's a small portion of what you're able to bring to the actual table.
Yeah, and this is the reason why I fell in love with plastic surgery and why it's such a great field, because a plastic surgeon kind of is the only surgeon still that operates from the top of the head to the bottom of the toes.
And you clearly do.
Yes.
So what about future outlooks for plastics in the area? What are some of the areas that you see, hey, this is something we're going to need to get into, this is another area that you're looking to develop?
Yeah, I think we spoke about breast reconstruction and all the options available to patients, and kind of getting the news out to the community that if you're happy, if you're not happy, if you have questions about reconstruction, that there's a provider here that can kind of help answer those questions, whether you want surgery, you don't want surgery. Patients have implants in, and they don't know what that necessarily means or how they need to monitor them. So I'm lucky to kind of have the community and the support of everyone here to be able to give those knowledge base to the community. And then outside of that, I think that there's definitely a lack of kind of cosmetic surgery in this area, and there's a lack of kind of real reconstructive surgery. And the great thing about plastic surgery is I work alongside my surgical colleagues to do a lot of these cases and to help the patients out. So hopefully it helps my vascular surgeons that may have a complex kind of leg wound that they need to deal with after saving someone's leg and doing a bypass. Helping my neurosurgery colleagues out so they can appropriately treat any kind of intracranial or brain problem that they should arise. So I like to kind of help out as many other surgeons as I can, and as a whole, the just patient population that we can serve grows as well.
And the other area that I'm thinking about as far as connectivity is our weight management team, which is pretty extensive here. And I've been reading a little bit more on this skin work that's been being done in plastics, and how that's like the next phase when we talk about confidence after somebody's lost after a procedure for weight management a certain number of pounds. There's a lot that then needs to happen after that.
Well, yeah, and you're 100% right. So obviously the bariatric surgeons here are extremely skilled and extremely busy, and so after these patients have gone through their weight loss journey, then and they're healthier and they're happier from that standpoint. The unfortunate or the secondary aspect of that is, now there's a lot of loose or hanging skin that can still have problems, or can interact with their quality of life. So these patients frequently can get some rashes under kind of skin folds, have difficulty fitting into clothing, difficulty moving, and so contouring that extra skin is something that I enjoy doing, and is a great service to the patient as well. And it kind of goes back to the reasons that I enjoy breast reconstruction, because it's a nice combination of reconstructive surgery, but also cosmetic surgery. So the goal always is to have an eye towards putting kind of the pieces or the puzzle back together, but doing it kind of in the most elegant and cosmetic way possible.
Beautiful, beautiful. So I like to sort of finalize our chat here with sort of nuggets that we can give to the patient. So, and in plastic surgery, I guess in my estimation, there's a couple of things in my mind that I wonder about. Scar is a big thing. So when could a patient say, if they get a cut, or where, if they get a cut, should they think about actually coming to see you after they get managed appropriately to make sure that cut is taken care of?
Yeah, so when we talk about scarring, kind of the typical answer is, your scar is not kind of finalized or at its the most mature level it can be until at least 12 months out. So scars go through many different phases of healing. They tend to kind of look ugly before they look better. And it will take really 12 months to soften a scar out. But in the interim, there are things that we can do, and some of that scar management kind of is as simple as staying out of the sun or putting high SPF sunscreen on, because the sun will damage the skin and the scar will get worse because of that. The other kind of products that I utilize in my practice is anything that is a silicone-based scar treatment is really the only products on the market that have been proven in the literature to have an effect on scarring.
Okay.
But then there's some other devices that, I think is definitely an opportunity for growth from, a plastic surgery standpoint, whether that is kind of microdermabrasion, which will increase the collagen around the scar, or laser treatments that can help to fade the scar over time. But these are all adjuncts to really just kind of getting your wound treated in a timely fashion. And making sure that kind of you listen to your provider and the instructions that they give to try to get the best result possible.
Wonderful, wonderful. Any last words for the patients here in the Greater Waterbury area?
The only thing I'd like to say is, thank you for welcoming me to your community, and I'm here to kind of provide the best care available and the best care that I can give. So it's a real honor to be here.
Well, it's our honor to have you as well. Thank you very much for joining us, and welcome you all to our next Facebook Focus in a few weeks. Thank you, and have a great day.